Welcome to the Mocktest Answer Key Explanation Series Part 7. This series is for preparing you for various nursing officer exams in government institutions. The topics include nursing applications, rationale of answers, and memory tips. This video will help you to understand and remember the topics in a better way for your upcoming exams. Let us go to the important multiple choice questions, answers, and explanation session. Welcome back all of you to the mock test explanation series, part 7. Next question. A palliative surgical procedure used in children with univentricular heart is option A, BT shunt procedure, option B, Whipple procedure, option C, Fontan procedure, and option D, Fothergill procedure. The right answer here is option C, Fontan procedure. Fontan procedure is a palliative surgical procedure used in children with univentricular hearts. Let us say Whipple procedure, it is pancreatico-duodenectomy. Fothergill surgery or Fothergill procedure is for prolapsed uterus. BT shunt will connect the arterial circulation to pulmonary circulation to improve the blood flow to the lungs. Let us see the memory tips here with the diagrams. Fontan heart, BT lung, Whipple pancreas, Fothergill uterus. Next question. Pyridoxine is otherwise called as option A, vitamin B1, option B, vitamin B2, option C, vitamin B12, option D, vitamin B6. The right answer here is option D, vitamin B6. Let us see the vitamin B complex and its numbers. B1 thymine, B2 riboflavin, B3 niacin, B5 pantothenic acid, B6 pyridoxine, B7 biotin, B9 folate, and B12 cobalamin. We have to remember this through the first letters only. That is the only way to remember. 1, 2, 3, 5, 6, 7, 9, 12. These all are the vitamin numbers. And TRN, that is the first name from thymine, riboflavin, niacin. Then PPB, pantothenic acid, pyridoxine, biotin, that is 5, 6, 7. And vitamin 9, B9 and B12 is folate and cobalamin, that is FC. Next question. A fold of peritoneum connecting the stomach with other abdominal organs is option A, Peyer's patches, option B, omentum, option C, gullet, option D, cisterna chyli. The right answer here is option B, omentum. The omentum refers to the folds of peritoneum that connect the stomach and other abdominal organs. Paired patches are lymphoid tissues in the wall of small intestine. Cisterna chyli is dilated sac located at the lower end of thoracic duct. Gullet is the other name for esophagus. Let us see the memory tips quickly now. Om peri, pair int, cis thora, esogullet. These are the short forms. Omentum, peritoneum, Peyer's patches, small intestine, cisterna chyli, thoracic duct, and gullet is other name for esophagus. Om peri, Peyer's int, cis thora, and esogullet. Next question. In which stage of labor the placenta is delivered? Option A, first stage, option B, third stage, option C, second stage, option D, fourth stage. The right answer here is option third stage. Let us quickly see the stages of labor. Stage 1, cervical dilatation and effacement. Stage 2, complete dilatation of cervix to delivery of the fetus. So stage 2, delivery of fetus. Stage 3 is delivery of placenta. Period following the complete delivery of newborn until delivery of placenta. Let us quickly see the memory tips here with color codes. 1, CX, 2, babe, 3, placenta. So stage 1 is cervical dilatation. Stage 2 is delivery of fetus. Stage 3 is delivery of placenta. Next question. A condition in which there is a strong urge to move, difficulty to stand still is option A, avolition, option B, ataxia, option C, adiadochokinesia, option D, akathisia. Here the right answer is option D, akathisia. Let us see the definitions. Akathisia is defined as an inability to remain stand still. Adiadochokinesia or dysdiadochokinesia is the inability to perform rapid alternating movement of muscles. Ataxia is impaired balance or coordination. So, ataxia is impaired balance. Avolition is the decreased ability of initiate and persistent self-directed purposeful activities. So, here you can see the memory tip with some diagram. All these are inabilities or lack of, that you have to remember. These all are the inabilities. Akathisia, inability to stand still. Akathisia, still. Adiadochokinesia, inability to or lack of rapid movement of muscles. Ataxia, inability or lack of balance and coordination. Avolition, lack of self-directed purposeful activities, lack of motivation. So, akathisia still, adiadochokinesia, rapid movement of muscle, ataxia balance, avolition, self-directed purposeful activities. These all are lacking in these psychiatric conditions. Next question. Down syndrome is also known as option A, trisomy 13, option B, trisomy 18, option C, trisomy 21, option D, monosomy 13. Here the right answer is option C, trisomy 21. Let us see the trisomy. Trisomy is a genetic disorder in which a person has 3 copies of a chromosome instead of 2. Normally it will be 2, but here it will be 3. Some trisomies, you can see the examples. Trisomy 21 is Down syndrome. Trisomy 13 is Patau syndrome. Trisomy 18 is Edwards syndrome. Trisomy X is XXX, female with extra X chromosome. Klinefelter syndrome is with XYX, male with extra X chromosome. So trisomy X, female with extra X chromosome, and Klinefelter, male with extra X chromosome. Here let us see the tip with the different symptoms and different corresponding chromosome numbers. These numbers are given in order for your better memory, and you have to remember in this order and connecting to this color code also. You have to remember the color code and order for better memorizing. 1. Huntington chorea is chromosome number 4. Cystic fibrosis, chromosome number 7. Sickle cell anemia, chromosome 11. Phenylketonuria, chromosome 12. Patau syndrome, chromosome 30. Angelman syndrome, chromosome 50. Edwards syndrome, chromosome 80. And Down syndrome, chromosome 21. Next question. Scaphocephaly is the condition in which the skull shape is option A, pointed, option B, flat, option C, board shaped, and option D, cone shaped. The right answer here is option C, board shaped. Let us see the different skull shapes and its terminologies. The memory tip here is scapboard, oxycode, brachyflat. Scaphocephaly is board shaped. You can see the diagram. Oxycephaly is conic or pointed. You can see the diagram here. Brachycephaly is flat shaped. See the diagram here. So scapboard, oxycone, brachyflat is the memory tip for your better memorizing in exam. Next question. A diet high in saturated fat can be linked to option A, kidney failure, option B, cardiac or heart failure, option C, anorexia, option D, bulimia. Here the right answer is option B, cardiac or heart diseases. You already know that the high saturated fat in diet can lead to cardiac diseases and other health problems because it will accumulate the cholesterol and it can form plaques in the coronary vessels and other areas. Next question. Which one of the following is the emergency management of burn injury in the first 24 hours? First 24 hours, what is the emergency management in burn? Option A, plastic surgery. Option B, fluid resuscitation. Option C, dressing. Option D, antibiotic therapy. The right answer here is fluid resuscitation. Here, this is an application level question with priorities or guidelines we will answer. Here we have to see the ABC protocol, life-saving intervention first, nursing priorities we have to apply, then national guidelines like NIBH and international guidelines is like JCI also we have to apply. So here, plastic surgery is a last option. We can understand that. It's a cosmetic option only. Dressing, it is also a secondary option only. It is not urgent. Antibiotics is also not that much urgent compared to the fluid resuscitation. So this is the priority. This is the right answer. So this way you have to answer these application level questions with priorities and guidelines. The fluid resuscitation in burn, Parkland formula also we will mention for your better knowledge for and refreshment. Initial 24 hours ringer lactate solution 4 ml per kg percentage of burn for adults and 3 ml per kg per percentage of burn for children. Next question. The method of operation in which separation begins in the center of placenta. The fetal surface is termed as option A, mini lap method. Option B, Schultz method. Option C, Matthew Duncan method. And option D, Wertheim's method. The right answer here is option B, Schultz method. There are two major types of placental separation methods, that is Matthew and Schultz method. So the tip is Matthew side, Schultz center. Schultz method is separation begins in the center of the placenta, and the Matthew Duncan separation method involves detachment of the leading edge of the placenta. It is from the side leading edge. Next question. A framework for quality care does not include option A, critical thinking, option D, safety, option C, effectiveness, and option D, high quality care. The right answer here is option A, critical thinking. We can see the quality care elements, tips, some ease, efficacy, effectiveness, efficiency, environment. These all are the E's. Then safety, effectiveness, and patient-centeredness. Professional standards and high quality care is also some elements of quality care elements in nursing. Next question. Screening children for catecholamines secreting tumors such as neuroblastoma, pheochromocytoma, and other neural crest tumors is option A, VDRL test, option B, VAT test, option C, Vidal test, and option D, VMA test. The right answer here is option D, VMA test. Let us see the tip here. VD SIP, Vidal tip, VAT word, VMA fear. VDRL test is for screening of syphilis. VAT test is for vertigo and imbalance, that is vestibular autorotations for vertigo and imbalance. Then Vidal test is for typhoid. VMA test is for the tumors like pheochromocytoma and neuroblastoma. So here VD SIP, Vidal tip, VAT word, and VMA fear. It's the short code for memory and for your short notes preparation. Next question. Wermer's syndrome is considered as option A, men 1, option B, men 2, option C, men 4, option D, men 3. Werner's syndrome. Werner's syndrome is, the right answer is option A, men 1. Let us see what is Werner's syndrome. Men 1 is multiple endocrine neoplasia type 1. That is men 1. That is Vermeer's syndrome. Men 2 is otherwise known as Sippel syndrome. So men is multiple endocrine neoplasia. These are type 1, type 2, type 3 and type 4. So men 2 is Sippel syndrome. Men 3 is also known as men 2B, and men 4 is affecting the parathyroid and anterior pituitary tumors. So these all are the memory tips for this particular question. Next question. Which one of the following include the immediate step in the resuscitation of the newborn? Option A, suction of the baby's stomach. Option B, clearing the oral and nasal airway. Option C, squeezing the chest to remove secretion from the airway. Option D, routinely giving sodium bicarbonate. The right answer here is clearing the oral and nasal airway. Here, this is also again priorities and guidelines application level question. ABC, airway breathing circulation, the life-saving intervention, and nursing priorities. See the options here. Suction the stomach is not that much important because that is not related to airway or breathing. Clearing the oral and nasal airway is on top priority because it is airway clearance. That is the ABC first priority. Squeezing the chest to remove secretions is not a priority comparing to clearing the oral and nasal airway because this is for the immediate breath. Routinely giving sodium bicarbonate is also not that much priority comparing to clearing the oral and nasal airway. So this is the way to answer these kind of questions. Next question. Who discovered the antibiotic penicillin? Option A, Alexander Fleming. Option B, Edward Jenner. Option C, Waxman. Option D, none of these scientists. So the right answer here is everyone knows. Option A, Alexander Fleming. Alexander Fleming, who is considered as the pioneer of antibiotics, who invented penicillin, and Edward Jenner, on the other hand, is pioneer of vaccination or immunology, who invented vaccines. Next question. Which is the main characteristic of a scientific research? Option A, empirical research. Option B, experimental research. Option C, theoretical research. And option D, historical research. The right answer here is option A, empirical research. Empirical research is based on observations and experimentation. Systematic, follows orderly and sequential procedure. So empirical research is the main characteristics of scientific research. Next question. Which function is transmission of sound vibration to the internal ear? Which part is functioning for transmission of sound vibration to the internal ear? Option A, auricle. Option B, tympanic membrane. Option C, vestibule. Option D, eustachian tube. Let us see the right answer. The right answer is option B, tympanic membrane. Let us see the ear and the different parts and its functions here with the diagram. Auricle or pinna will collect the sound and transform it. Tympanic membrane is functioning for the transmission of sound vibration into the internal ear. So this is the right answer here. Vestibule is responsible for maintenance of balance. Eustachian tube is the area where it will balance pressure in the middle ear and it will drain the fluid from the middle ear as well. A patient in heart failure has a drug advice of dopamine 5 microgram per kg per minute. Dilution of 200 milligram dopamine done in 50 ml dilute. Patient's weight is 60 kg. How many ml per hour of the solution should be set in syringe pump to infuse the prescribed dose? Here this is an application level question. Calculation is required. So you have to pause the screen if you need more time to calculate by yourself and see the right option. The options here are Option A 5.4 ml per hour. Option B 4.5 ml per hour. Option C 3.6 ml per hour. Option D 2.7 ml per hour. Here the right answer is option B 4.5 ml per hour. Let us see how it is calculated. The required dose here is 5 microgram per kg per minute. The syringe pump will go in ml per hour. So we have to convert this to ml per hour. So weight is 60 kg and dilution is 200 microgram. 1 milligram is 1000 microgram. That also you have to remember. So 200 milligram is added in 50 ml. So 200 milligram in 50 ml means it is 200 into 1000 microgram. That is 200,000 microgram in 50 ml. So 1 ml is containing 200,000 divided by 50, that is 4,000 microgram. So each ml of this diluted solution will contain 400 micrograms. Sorry, 4,000 micrograms. See, that is the calculation. Each ml contains, so per ml we have to find first. Per ml, 1 ml is containing how much? That is the main thing you have to identify. So here each ml contain 200,000 by 50, that is 4,000 microgram. Now go to the formula. 5 microgram per kg per minute is 5 into this kg. 5 is microgram, then 60 is the kg. So 5 into 60, then minute to hour. So 1 hour is 60 minutes. So that's why we are multiplying by 60. That much microgram per hour it should go. So that is 5 into 60 to 60 is 18,000 microgram per hour it should go. So 1 ml is containing 4,000. So 18,000 microgram, how many ml is required? So 18,000 divided by 4,000, that is 4.5 ml is required. So the answer is 4.5 ml per hour. The sixth test is done for the diagnosis of option A diphtheria, option B measles, option C rubella, and option D mumps. The right option here is option A diphtheria. Sixth test is for diphtheria, and the other test we have already seen, VMA, then VDRL, Vidal and all we have already seen. Next question. What is the cardinal sign of meningitis? Option A Trousers sign, option B curling sign, option C ortholani sign, and option D joystick sign. The right answer here is option B curling sign. Let us see the different signs and the diseases related to that. Kerning sign is for meningitis. Joystick and Trousers sign is for hypocalcemia. Ortholani sign is for dislocated hip. Next question. Bile salts are important for digestion of option A fat, option B protein, option C carbohydrate, and option D iron. The right answer here is option A fat. Bile salts are important in solubilizing dietary fats in watery environment of the small intestine. Next question. Effective approach in preventing pulmonary embolism is to prevent option A heart disease, option B deep vein thrombosis, option C chronic obstructive pulmonary disease, and option D diabetes mellitus. The right answer here is deep vein thrombosis. As all of you know, pulmonary embolism occurs when a part of DVT plot breaks off and travel to the legs, so which can be a life-threatening condition. So to prevent pulmonary embolism, we have to be careful about preventing DVT. DVT prophylaxis you have to follow. Next question. Which assessment method will be useful after the client has been discharged? Option A auditing, option B retrospective evaluation, option C concurrent evaluation, and option D summary evaluation. The right answer here is option B, retrospective evaluation. Here you can see the word itself. Retrospective means looking back. So when the patient is discharged and gone, then this will be obviously retrospective, dealing with the past events or situations. So this is retrospective. Concurrent means happening at the same time. So when the patient is already inside the hospital, that time concurrent auditing or concurrent assessment method can be applied. But when patient is discharged already, then retrospective evaluation can be done. Next question. Which one of the following is a function of the liver? So which is the function of the liver here in these options? Option A, synthesis of plasma protein. Option B, elimination of carbohydrate. Option C, concentration of bile. Option D, secretion of cholecystokinin. The right answer here is option A, synthesis of plasma protein. Let us see the functions here. Synthesis of plasma protein is the function of liver. Concentration of bile will be the function of gallbladder. Elimination of carbohydrate is by the alimentary canal or colon, and cholecystokinin is produced by the small intestine. The final question of this series. A patient on O2 via nasal cannula 1 to 3 liter per minute. The current O2 is on flow and at 2 liter per minute, and SpO2 shows 87% and PCO2 in normal range. What is the most appropriate action among the below? Option A, decrease the O2 to 1 liter per minute and monitor SpO2. Option B, continue O2 at 2 liter per minute and monitor SpO2. Option C, increase O2 at 3 liter per minute and monitor SpO2. Option D, continue SpO2 monitoring and call the doctor. Here, this is a practical application level question. You have to see the answer here. I will explain it. The answer here is option C, increase O2 at 3 liter per minute and monitor SpO2. Here, this is application level question, and you can see the options one by one and eliminate this. Decrease the O2 1 liter per minute is not obvious. It will worsen the condition, so that we will rule out. Continue at 2 liter also will not help, so that also will rule out. So only these two options are remaining here, option C and D. So C is increasing the O2 at 3 liters. So it will improve for sure, but one more option will be confusing, that is D, continue SpO2 monitoring and call doctor. This is not correct, because even if you continue the same and you call the doctor also, the saturation will be the same only. If the doctor comes, he will also try to increase the oxygen or do the alternative method. So in this condition, particularly the most appropriate is first to see the O2 rate increased and watch the patient and improve the SpO2. Then you can call the doctor if it is not improved or it is necessary. So these kind of questions or application level questions you have to remember. The calculations also you have to remember in mind, that you have to go for priorities, calculate all the calculation with your presence of mind. Take your own time. If you have any doubt on calculation, you please ask me in comments, or we will discuss another sessions for calculation as well. Already some videos uploaded, more sessions will be coming. Thank you all for watching this video. Please like, share and comment for these videos, and more exam preparation videos are on the way. Thank you so much.